What I hope for governments and decision makers is for them to put politics behind and our health first, and for their decisions to be more fair, transparent, and inclusive, because more than ever, we know that no one is safe until everyone is safe. Thank you.
My biggest hope for future international agreements on pandemic preparedness include solidarity, inclusion, and trust. It's not about a blame game, and no one knows everything before it even happens. So we have to trust the governments and science so that we can get out of future pandemics.
It is my hope that the international agreement comes to a sustainable solution that will enable us to be better prepared for the next pandemic. We can be creating an emergency framework where we can mobilize resources from those with the many to those with the few at a reasonable cost. Because at the end of the day, our destinies are interconnected.
My biggest hope for 2022 is that leaders who will start negotiating the new pandemic treaty will give a seat at the table to communities who are often left behind, like migrant workers or unpaid carers. I hope that this new treaty will take a human-centered and social determinant of health approach, because only that would allow for future crisis management to be truly cross-sectoral, acceptable, and fair.
When we think about a legally binding global pandemic treaty, I think most important is that we bring stakeholders from the global south to the table so that we can really understand what's important when we tackle pandemic preparedness and also vaccine inequity on a global scale.
It must be ensured that everyone, everywhere gets access to essential medical products, such as the vaccines. Sharing the know-how and the patents of these is vital, so low and middle-income countries can produce things themselves, making them less dependent on high-income countries.
My biggest hope for future international agreements on pandemic preparedness is that they lead to shared accountability and mutual responsibility, rather than widening the divide between the global community and hindering our ability to prevent and manage future pandemics.
I think any future agreement should be built on a new social model. This pandemic has accelerated decades of innovations across many sectors that influence health. Our priority now should be to ensure these address people's needs in an inclusive manner. We must agree that we have to redefine what we understand by health and what is our responsibility towards health. Moving forward, we have to recognize the role of new players that can shape what we call the new normal, and also rethink certain areas that have been neglected so far, such as public health.
For the future concerning pandemics, I'd like to see greater collaboration, greater investment provided for surveillance, detection of diseases, and of course emerging infectious diseases. I'd like to see greater collaboration between public and private sector enterprises, and the key players around the world should have a stake to play in providing global health security.